patient Erin. She's in this afternoon for back pain. You're having some sciatica pain, neck pain also. Tell us a little bit about how this started and how you're feeling.
Well, I wake up every day with lower back pain. Some days it's hard to even get out of bed or pick up my children. Both my parents have back problems, so I'm not sure if that's related. I've never had an accident or anything, so
and when this bothers you, what are some of the things that affect the way you're able to live your life with your sleep and
well, it's a constant thing. I have good days and I have bad days. Sometimes I'm able to, when I'm laying in bed, my back will catch, and it's very sharp, paralyzing feeling, where I can't even stand up by myself. And if I'm interacting with my children sitting on the floor, crossing my legs, my toes start tingling and I constantly have to move my legs or my back.
Okay. And that's a pretty uncomfortable feeling when your toes start going numb. And
yes.
You've had some weakness in your legs also from the nerves being pinched in your low back?
I can walk down the hall and my leg, it feels like my leg is just going to give out.
Okay.
And my children are like, "Are you all right, Mom?" So yeah.
So we were able to obtain some x-rays in the office and kind of target in where we think a lot of your dysfunction and pain is coming from. And it looks like down here at L5, S1 at the very bottom of your low back, you have a degenerated disc. And oftentimes this will look very thin and degenerated on an x-ray because that material in your lower back has bulged out. And it would likely look like this. You can get some pressing on the nerve, the sciatic nerve that goes down the back of your leg and causes numbness. So we think we found out where her problem is. We're going to go in and treat this area. We're also going to get your neck. You've been having some neck pain and neck stiffness.
Yes.
And let's see if we can get you a little relief today with chiropractic treatment. All right, so we're going to check a couple things on your spine. I'm going to take a look at your muscle strength. We're going to do some orthopedic neurological tests just to see if we can reproduce some of your symptoms to see where this is coming from. Any back pain with that?
Yes.
What about in the leg? Any leg pain or just back pain?
Just back.
So we call that a positive Bacterouz test. We're tractioning up the sciatic nerve, and if that causes back and leg pain, it can be indicative that there's something wrong with the discs and sciatic nerve in the low back. What about that? Any pain with that?
A little bit.
In your lower back? Okay. I want you to press your legs out into my hands, nice and strong. In, good. Up here, good. I want you to kick your leg out, nice and strong, good. Same thing here, good. Bring your feet up, good. Don't leg press down, good. Same thing here, good. Roll your foot in like you're kicking a soccer ball. Don't leg press out, nice and strong, resist, good. Same thing here, good. And then the opposite, bring your feet out, good. Good. Okay, so your muscle strength looks pretty good. And go, let's see. See how it's a little decreased on this side? All the way forward. Does that hurt? Any pain?
A little bit.
A little bit. Come on back. Any back pain?
Yes.
Okay. Any back pain here?
Yes.
Any back pain here?
A little bit.
What about in your neck? Look all the way up? All the way down?
Yes.
Any pain?
Yes.
That hurts too.
Yes.
Okay. You're really stiff of it. Do you hold a lot of stress in your shoulders?
I think so.
That's all right.
I've got, I wake up most of the time with my neck and my shoulders hurting.
Okay. Let's take a look. Can you lay face down here on the table? Good. Any back pain here?
Yes. Oh,
That hurts.
yes.
Okay. Any back pain here?
Yes.
So I think some of this is coming from your pelvis as well. There's some alignment issues that we're going to address. So I'm going to get your neck here. You're going to hear some little adjustments in your spine. Let's go face up. Can you lay on your back for me? And you've never been to a chiropractor before, is that
No,
right?
never.
Good. I'm just gonna turn your hand. You're doing really good. Great. So we can feel right here, this joint is misaligned. I'm gonna go into it and put it back in place. Very good. Kind of surprising, huh?
Yeah.
Any pain with that? So this is another test we use for to check for sciatica and disc-related problems. Does that hurt? Okay. Let's see. We're gonna scoot down a little here on the table. Cross both arms. Squeeze here. Wow. Great. And let's get your lower back. Can you lay here on your side, face me? We're gonna bend this top knee up. Good. Straighten the bottom leg. You're gonna bring this shoulder forward. That'll work. Good. And then this part of your back is gonna go this way. Very good. And let's go to the other side. Same thing. You're gonna come over just a little here. We're gonna bring the shoulders back. Good. Roll towards me. Excellent. So we've just finished her chiropractic adjustment. We're gonna get her on some physical therapy now with some back exercises, some lumbar traction, and then she'll be all set and we'll talk after that. So we've got her on our flexion distraction technique, and we use this for sciatica and lower back pain. It's great. It's gonna, what we're trying to do is decompress the lumbar spine with an attempt to bring down some of the irritation on the nerve roots and alleviate some of the pressure in our low back. We use this for herniated discs, degenerative disc disease, sciatica, low back pain, tightness in the muscles in the low back, muscle spasms, and the patients really respond well to it. It's a great technique we use here in our office. finished with your treatment. You had a chiropractic adjustment on your neck, your mid back, and your low back. You had some therapy. You used our decompression table here with some muscle stimulation. And we took her through some back strengthening exercises. How do you feel now? Your pain was a 7 when you came in. How high is it right now?
Maybe about a 1 or 2.
Okay, so she's gotten some good relief from just one treatment. It's Dr. Jeffrey Gerdes here, your Raleigh Chiropractor, neck and back pain relief. Thanks for watching.